Now we have time to read the question. I will read the question and please ask depending the topic. The first one is a thanks for Esperanza.
Oh yes, yes. If you allow me, Marina, I remember you very well, and it's a great pleasure to see you again. I'm very happy you are practicing ultrasound.
There are two questions about referencing enthesitis.
Yeah, yeah. Yes, I will say that I didn't include any reference because there are so many, not to overload the slides. But when the papers are published, you can find the most important reference in the literature, where we base it on our literature review and our clinical applications points, and also the practical points and limitations. So hopefully the paper will be published very soon, and then you can have a lot of literature there. So do anyone any contrast enhance?
In this implication.
Yeah, the third one is place mentions on articles for reading about enthesitis, same answer. There are so many that I really couldn't, was unable to select for the slides, but you will have all of them absolutely updated in the published paper very soon. Does anyone use contrast enhanced ultrasound in these applications? Where in the past there were some papers, very good papers and solid on that. However, using contrast enhanced obviously is increasing our sensitivity for detecting Doppler signal. However, the procedures then becomes a little less feasible in clinical practice. So because of that, as far as I know, we are not using a lot this in clinical practice, but mainly in research. Anyway, in the literature review also are included papers on that. Can we use elastography to assess tendinopathy? Of course, elastography is a useful tool to enhance our diagnostic capability, and there are many papers on that. I believe in the paper is also included a section on that, or elastography. Not enough on this webinar to deal with this topic. However, we believe that we need still further standardization. We can say between systems, between ultrasound equipments, and between technology, and between observers, so ultrasonographers, for implementing this technique in clinical practice. So further validation is needed, mainly on this, on reproducibility and standardization between different ultrasound systems, but of course a very useful complementary tool to a classical or conventional ultrasound. And I think I don't have any other question for my topic.
Dana? I want to complete your answer concerning the elastography. A few years ago, there were published EFSUMB guidelines and recommendation of in non-liver elastography, and there is a chapter about musculoskeletal elastography. We decided not to include elastography. For this reason, we decided not to include elastography in our guidelines. Because in this time, in these 2-3 years, there are published not so many papers that would change the previous recommendation. And this is the reason that you will not find recommendation concerning elastography in all musculoskeletal ultrasound. The last question is for Carlo. Carlo, can you take this question? Do we have fixed now numbers of?
So the nerve fascicular imaging, yes. So yes, it's important. You have to consider a nerve like a jellyfish, no, with the tentacles, no, and each the tentacles are the fascicles, and they are completely autonomous from each other. So in different conditions, it may have a sense to check the fascicle, not just to check the bundle, the main bundle of the nerve. And this condition may be traumatic injuries. I showed an example, no, of a partial nerve injury. And based on the position of the fascicles, you can also follow them. You understand exactly the territory where they go and distribute. And is also an important point in terms when you have to perform a reconstructive surgery to anastomize the transected nerve correctly with grafts. Is a new application, of course, of ultrasound, perhaps beyond the guidelines we prepared. Similarly, in cases of compressive neuropathies, not uncommonly, you may have some neuropathies in which a group of fascicles is affected and the rest no. This typically occurs with the peroneal nerve at the fibular head. So the anterior fascicles tends to swell much more than the posterior ones in general. So there is a differential grade of abnormalities between the different zones of each nerve. And finally, I showed some example of the dizzy-mu neuropathies in which not uncommonly one of the fascicles is affected, the other ones are spared, and then depending on the level, there is some pathology that is based on a single fascicle, not on the nerve as a whole.
Okay, thank you. And there is another question. I think that this is for Fernando. Please, yeah. Fernando, take the question.
This is from Pedro Gerardo Ordóñez. What happens with the scar subcutaneous after plastic surgery? Well, if there is a scar, there will always be a scar, whether we see it or not. We cannot remove a scar without leaving a scar. Then there will always be a scar, whether we see it or not. It will be concealed on the subcutaneous tissue. Ultrasonographically, we will always see that something has happened there. The internal scar persists there.
Okay, thank you. I see that there are no other questions. And we are at the end of this meeting. I want to thank everybody. For the participants, it was an impressive number. I want to also thank every participant for their interest in musculoskeletal ultrasonography. I want to thank to the speaker. And I remember you that next week, also in Wednesday, we have the second part of the EFSUMB guidelines in the musculoskeletal ultrasound. Okay.
Thank you very much, Daniela. Thank you very much to all attendants, and we wait you next week.